Good afternoon, Mr. Jones. My name is Cassie Meyer, and I'm looking at your. I'm a nursing student at University of South Alabama, and today I'm looking at your chart. And I see that I'm going to insert a saline lock, if that's all right with you, Mr. Jones. All right. So I'm looking at the hospital policies and procedures, and I understand them all. So let's go ahead and get started. I'm going to perform hand hygiene and make sure your wristband matches my chart. So Jaguar J. Jones is your full name, and Jaguar J. Jones is correct. Date of birth, 8/25/1963, and I see 8/25/1963. I see you have an allergy to penicillin both on your wristband and my chart. Are you allergic to anything else? No? Okay, that's great. So we're gonna go ahead and get started. I gather my supplies, and I'm gonna position my trash can, and I'm going to perform hand hygiene. Next, I'm going to don my goggles and raise the patient's bed to a comfortable working height and lower the side rails and position the patient either supine or sitting up. And the next thing I'm going to do is go ahead and take out all my supplies. So I'm gonna put this shiny side down. Go ahead and get out my tape. And not everything I need right now, yes. Okay, so I'm gonna go ahead and take this out and maintain the sterility. I'm gonna push only the IV tubing part. And here's my syringe. And the first thing I'm going to do is wipe off with a alcohol swab the top of this IV extension tubing. And once it's been vigorously rubbed, I'm going to allow it to dry. And once it's dry, I'm going to take this saline syringe and uncap it while also maintaining sterility, not touching the end of it. And I'm going to insert the tubing together, and then I'm going to flush the tubing over my trash can. Okay, and once it starts leaking out a little bit, I know that's flushed. I'm going to put that back on the wrapper. Okay, so 3 ways to foster venous distension is by gently rubbing the vein and putting a warm compress on it and putting the arm in a dependent position. 3 ways to pick the site of insertion is to use the arm that's non-dominant, and use pick a site that's more distal to the body and also not in a region that's in the antecubital or a place that's frequently bent, or the wrist, and also one without bruises, or if there's a graft, then I wouldn't put it in there, or if the arm was paralyzed, I would use the other arm. So the next thing I'm going to do is clean my patient's arm with the chlorhexidine solution. So I'm gonna pop this and clean it for 30 seconds, vigorously, horizontally, vertically, and in circular motions for 30 seconds. And then once it dries, I'm going to make sure that's the last thing I need to do. Okay, once it's dried, I'm going to go ahead and put on my patient's tourniquet. So I'm going to wrap tightly around my patient's arm and not make a knot, but just a little bump under so that I can easily pop it afterwards. Okay, next I'm going to put on my clean gloves, and I'm going to unwrap and uncap my IV, or my needle. Put that in the sharps container, and I'm going to bring the sharps container a little bit closer to me for the rest of this procedure. What I'm going to do is 1 to 2 inches below the side of insertion, I'm going to gently pull back on the skin and insert the IV bevel up and at a 10 to 30 degree angle parallel to the vein. And once I see venous return or blood return, I'm going to push the needle down and insert the catheter 1/4 of an inch and then insert it completely. And then I'm going to push the needle down and so I'm going to push and pop the tourniquet and going to place pressure above 1/4 inch above the needle. Throw this in the sharps container. Quickly take off the top of this tubing and, maintaining sterility, lock it into place. Okay, and the next thing I'm going to do is temporarily tape it, avoiding the hub with piece of tape. Okay, and then I'm going to aspirate for blood return and then insert the saline solution all the way and looking for swelling at the site of insertion. And once that is in place, I'm going to unhook the saline tube and throw that in the sharps container. And now I'm going to place the Tegaderm on the site. Yes. Bring that away. And what I'm going to go ahead and do is avoiding the hub, placing it on the side of insertion, making sure there's no air bubbles or anything. And once that's on, I'm going to throw that away, and I would mark on the date and time and my initials of the site of insertion, or date and time and site of insertion, date, time, and initials, and the gauge at my site of insertion on this label. Okay. All right, now I'm going to gently wrap the tubing in a comfortable, or take the tubing in a comfortable position, like a natural falling position. Okay, and once that is on, I'm going to go ahead and clean up my area. So I'm going to, normally I would throw like all of this away actually. I'm going to go ahead and leave this towel there because I know I'll need it for the next part of the video. And I'm going to throw this away and take off my clean gloves. And then I would educate my patient on things to look for in at his IV site. So I would tell him not to try to dislodge it and be careful when he's moving around. If he's going to go take a shower, he needs to be careful and wrap it, or get a nurse or nursing assistant personnel or a nurse to wrap it before getting into the shower. And then I would tell him to look for signs and symptoms of complications such as blood in the tubing, and then also if the drip stops or the saline stops flowing, to notify a nurse or a physician. And then also tell my patients about symptoms to look for phlebitis, infiltration, and inflammation. So some of those symptoms could be redness and swelling, edema, coolness or hotness to the skin, or an increase in fever. Okay, and next I would document my patient's, I would document how my patient handled the procedure. Well, okay, before I document, I would, after instructing my patient, I would actually need to lower the bed all the way down, put the side rails back up, put my patient in a comfortable position, and then tell them about all those things like I already said, and then I would need to document, like I said. Okay, so the only step I missed out of order was positioning my patient. Okay, so then I would document the how the patient handled it, what type of saline, drip, and the rate of the drip, and I would also need to talk about the method of infusion and the type of gauge and length of the needle that I put in, time, date, and initials of the site of insertion and where the location of the insertion is, and then how the patient tolerated it and the number of attempts it took me to insert the needle. Okay, once I was finished documenting, I would come back later and take out the needle or the IV site. And so what I would need to do is gather my supplies and I think all I need is that. Okay, so go ahead and unwrap this, throw this away, put on my clean gloves. And I would need to stop the infusion as well before taking out the needle. I would need to make sure that the bed is in a comfortable working height, so I would raise the lower the side rails and raise the bed again. And I would need to observe that my patient was doing well. So what I would do is go ahead and stabilize the catheter and begin pulling back the Tegaderm dressing. Towards the site of insertion. And take off these pieces of tape. Okay, and once this is out, throw this away, and it's still stabilizing the catheter, I would pull out at a parallel position. Slowly, and throw this away in the sharps container. And I would have my gauze ready to catch the blood, so I would actually have that out prior, and put the gauze above it and then pull out the needle. So then once the needle's out, the gauze would be right here to catch the patient's blood and anything else. And then I would wipe that off and hold the compress for at least 30 seconds to a minute. But if the patient had any anticoagulation blood in his system, then what I would need to do is hold it for 10 to 15 minutes until the bleeding stops. And then I would need to get another piece of tape, which I forgot to go ahead and tear prior, and tape it on there. Okay. So I would make sure that the blood had stopped flowing before releasing my pressure and putting tape, and then I would securely fasten the tape to the patient's arm that looks a little tight, but I would make sure it's not cutting off circulation. And then I'll go ahead and clean up my area again. Now this time finally removing the towel, but this would have been the second towel I removed from him. And cleaning up my area. And taking off clean gloves and then positioning my patient in a comfortable position. So lowering the bed, raising the side rails, and I would also document again how the patient handled it and any other notable points that I didn't already mention earlier. That I already mentioned earlier.